How can status epilepticus cause brain damage? Imagine a seizure that just keeps going without stopping, or a series of seizures that happen so quickly your brain never fully recovers in between. This is what we call status epilepticus, a serious medical emergency that can cause lasting harm to the brain if not treated promptly. During a seizure, neurons in the brain fire abnormally and excessively. Normally, the brain has mechanisms to control this activity, but in status epilepticus, these controls fail, and the seizure activity continues unchecked. This ongoing activity puts the brain under a lot of stress. One major way that status epilepticus can damage the brain is through increased metabolic demand. When a seizure happens, neurons need much more energy, which means they requiring more oxygen and glucose. If blood flow or oxygen supply is inadequate during this time, brain cells can become injured or die. This is similar to what occurs during a stroke, where lack of oxygen causes brain tissue to die. The longer the seizure lasts, the more energy the brain needs, increasing the risk of damage. Another key factor is excitotoxicity. During prolonged seizures, the brain releases too much of a chemical called glutamate, which excites neurons excessively. This overexcitation causes an influx of calcium into the cells. Excess calcium triggers a chain reaction that damages or kills neurons. This process is called excitotoxicity and is a major contributor to brain injury during status epilepticus. In addition, the normal balance between excitatory signals, which promote neuron activity, and inhibitory signals, which calm it down, becomes disrupted. Usually, neurotransmitters like gamma-aminobutyric acid help keep activity in check. But during a prolonged seizure, this inhibitory system becomes less effective, allowing excitatory activity to continue unchecked. This imbalance worsens the damage. The hippocampus, a part of the brain involved in memory and learning, is especially vulnerable. Prolonged seizures can cause injury to this area, which may lead to memory problems or other cognitive issues later on. Systemic effects also play a role. The body's stress response during status epilepticus can cause increased heart rate, blood pressure, and body temperature. These changes can reduce blood flow and oxygen delivery to the brain, further increasing the risk of injury. In children, the developing brain is even more sensitive. Long-lasting seizures can interfere with normal growth and development, potentially leading to learning difficulties or behavioral challenges. The risk of brain damage depends on several factors, including how long the seizure lasts, the cause of the seizure, the person's age, and how quickly treatment is given. The longer the seizure continues without intervention, the higher the chance of permanent neurological damage. Prompt medical treatment is essential. The main goal is to stop the seizure as quickly as possible using medications called anti-epileptic drugs. Supportive care, like ensuring the person can breathe and maintaining stable blood pressure, is also critical. In some cases, more intensive treatments are necessary. For people with epilepsy, understanding these risks highlights the importance of following prescribed medications, recognizing seizure signs early, and having a plan for emergencies. If a seizure lasts longer than 5 minutes or if another begins before full recovery, emergency help should be sought immediately. In summary, status epilepticus can cause brain damage through a combination of increased energy demand, excitotoxicity from excess glutamate, disrupted inhibitory control, and systemic stress responses. The hippocampus is especially vulnerable, and the longer the seizure persists, the greater the risk of lasting harm. Acting quickly with medical intervention can greatly reduce these risks. Always consult healthcare professionals for personalized advice and emergency care. This understanding is based on current scientific knowledge and guidelines from major health authorities, emphasizing the importance of timely treatment to protect brain health.